the superior vena cava and the inferior vena cava. So let's start with the superior. So superior, we get the branch, and this is the azygos here. This is the ascending lumbar. This is the hemiazygos, accessory hemiazygos. That's what I was creating there. But specifically, we're going to get two branches, right? What are these two branches? So this is the superior vena cava. What are these two branches?
Internal.
Right and left brachiocephalic, right? So because I have the left, this is the left brachiocephalic. Brachiocephalic branches to become the internal jugular, goes to the same area as the internal carotid. Then we also get another branch that becomes the subclavian, right? Subclavian branches a few times. So subclavian branches to become the internal thoracic or mammary artery or vein. The external jugular. So external jugular is going to go to the back of the skull, right? It also supplies the teeth, right? And you also get another branch that is going to travel within the vertebral foramen of the cervicals. Just like the vertebral artery, the vertebral vein travels in the same route, and they both go where? Which hole?
The foramen.
The foramen magnum, right? Okay, perfect.
Yeah.
All right. So subclavian goes under the clavicle, becomes the axillary. We get some branches. What are these branches? What is the outermost, the longest vein of the arm? What is it?
Cephalic.
Cephalic, right? We get another branch, which is the
bacillus. I'm sorry.
Brachial. If we follow the brachial is a deeper vein. What does the brachial become?
Median cubital.
What does the brachial become?
Median. What?
Ulnar and radial.
Oh, okay.
Right? So that's what the brachial becomes. Ulnar and radial. Now let's go back to where we have another branch coming off of brachial. What is this innermost? It's medial, right? What is this vein? Basilic. We get a branch coming off of basilic. It goes over the inner portion, the inner crease of our forearm, our elbow area, which is what? What is this vein? Median cubital. This is the primary source that they're going to try to withdraw blood from you, right? What does the median cubital become? Median antebrachial, and then you can see the palmar arches, right? Now let's go back down to the leg. So we have the inferior vena cava. Inferior vena cava branches at the coxal bone area, the ilium. What is this called? Common iliac. What is this branch here?
Deep.
Internal iliac. External. When it goes past the inguinal ligament. Femoral. What is this branch here? Deep femoral. So deep femoral goes to the back of the leg and it stops. What is this branch here that's going all the way down the middle, or not the middle, but then the medial part of our legs? Great saphenous. Is this the longest vein of the leg?
Yes.
It is. So we have the great saphenous, the deep femoral. Femoral vein does the same as the femoral artery. Goes to the back of the leg. When it's behind the knee, it is the popliteal. So now you can see several branches taking place, right? So you see one branch is going which way? Which direction?
Anterior.
Anterior. So what is that anterior branch becoming?
Tibial.
Anterior tibial vein, right? What is this other branch that we see here? Running on the lateral portion of the leg.
Fibula. Fibularis.
What do you need to know in the veins of the leg? So we know that this is what?
So small saphenous. Great saphenous.
This is great saphenous. Small saphenous is here, right? But you also have fibular, and you also have the posterior tibial.
So which one's posterior, which one's anterior? The small saphenous is running.
It's lateral.
Trying to go to the.
Well,
front?
the great saphenous is running medial down your leg. This, well, I should say your thigh and your leg. The small saphenous just runs on the lateral portion of your leg. So remember, below the knee, that is really considered the leg, whereas the femur is considered your thigh. But we always just keep it simple and call it the leg. All right, so we have anterior tibial. It's gone anterior. We have the fibular, and we have, or peroneal, and we have the posterior tibial. And we have the, what is this? Dorsal venous arch. And what about plantar?
It's underneath.
It's underneath. So we're not going to be tested on that, right? Okay.